Hello, welcome back to my channel. I'm here in the sun enjoying a bit of vitamin D that will help my calcium absorption and retain them in the body to give me a healthy bone. So today we're going to talk about bone health, conditions that affect bones such as osteopenia and osteoporosis. Alright, so just stay with me for a while. I'll be right back.
Hi guys, Ajon here. Thank you once again for being with me. I'd continue to subscribe to the channel. So when we talk about osteopenia, it's just low bone density, and osteoporosis is when the bone become weak and leads to its easily breakage. Now it can occur mostly at the hip and spine, but can occur in other areas as well. Right? It mostly affects menopausal women and the aged, but can affect other age group as well. Calcium and vitamin D are the major minerals for bone health. Calcium is the main mineral found in the bone, and vitamin D helps with the absorption of this calcium. Now, how does the body get these minerals? By eating a variety of balanced diet fortified with these two minerals. Calcium, for instance, can be found in green leafy vegetables such as kale, rocket, celery, okra, and then even spinach. But spinach has a higher level of calcium which the body cannot even digest at all. There are other sources such as yogurt, milk, which is fortified, seeds such as flax-seeds, chia seeds. There are also nuts, all variety of nuts, but mostly with almond nuts, which has the highest level of calcium. Fortified foods such as soya drink, bread, and anything made with fortified flour has also calcium in it. Let's move on to vitamin D. The main source of vitamin D is sunshine. So sensible sunshine exposure, especially in the early hours in the morning when the sun starts coming out, produces vitamin D in the skin that may last as twice as long in the blood compared with ingested vitamin D. That is vitamin D that you've gotten from other sources. There are other sources of vitamin D such as oily fish, red meats, liver, egg yolk, fortified foods such as bread and cereals, oatmeal, mushrooms that have grown in daylight also contains a bit of vitamin D. Let's take note here that too much vitamin D will cause too much calcium built up in the body and can also lead to bone breakage. Now, the other sources which we can get from supplements to support the low level of these vitamins in the body. Vitamin D supplements comes in different variety of forms. It can be in a spray or soluble tablet or any other, which is being given all the time. We have calcium. Calciums are tablets that are a great source of calcium, and it's used in the correction of dietary deficiencies as an adjunct to conventional therapy in the prevention and treatment of osteoporosis. Now, your doctor, after assessing your calcium level, will know the amount of calcium that can prescribe for you as a supplement. Now, so how can osteoporosis occur? But in simple terms, osteoporosis can occur when the individual is aging, okay, and it's not taking enough of these minerals that we've talked about, vitamin D and then calcium. There are other also new factors that such as excessive smoking, excessive alcohol intake, and then caffeine intake as well, or even malabsorption of these minerals. So to prevent osteoporosis from happening, there's the need to take adequate diet that contains these two minerals, or exposure to sunshine if there is sunshine. There's also adequate physical activity that help the bone to be much healthy. All right. Now let's talk about Prolia. Prolia is an injection and it's used to increase bone mass. It's used to treat osteoporosis in certain patients who have had a high risk of breaking bones. The recommended dose of Prolia is 60 mg and is administered as a single subcutaneous injection in the upper arm, the upper thigh, and on the abdomen every 6 months. If a dose of Prolia is missed, administer the injection as soon as the patient is available. And then thereafter, you schedule injection every 6 months from the day of the last injection. Okay, that ends our information for today. Let's move on to the last bit. Now to our case study. So Mr. AC, a 78-year-old man, had a crack in his hip when standing from sitting. He has now been admitted to the ward with a diagnosis of hip fracture and osteoporosis. He had a hip replacement done and has been put on injection Prolia that is to be given every 6 months. He's now due for discharge, and his daughter JK was wondering what could be done to prevent further occurrence and what could be the side effect of this new injection that has been prescribed. Right? Now, based on this case study, we can derive from our previous discussion about what can be done to prevent future occurrence. That's the minerals that we've talked about and the food that you can eat, fortify these mineral supplement and all that, exposure to sunshine. And then the injection, the main side effects being hypoglycemia, and then how it's being given every 6 months. It's basically simple as that. All right. So that ends our discussion for today. Please share, subscribe. Thank you.